we all say it's surface, but really all of this stuff really affects our confidence and how we sort of deal with life. So Dr. Steve Mulholland is live with us. That's really nice to see. So they went through the procedure. I was ribbing them before the show. Tell me, did it hurt? Did it hurt? And they're saying, no, it didn't hurt. And, you know, one of them absolutely hates needles. And she said, even being a needle hater, I went into this and it was fine. So tell me a little bit about the pain involved, and then let's talk about exactly what the procedure is.
The procedure that we did was a volumization, so restoration of wrinkles in the skin, loss of volume in the face with soft tissue fillers. And we're now into the 20th year. Restylane been around for 20 years now. So it's really revolutionized our ability to do non-scalpel, non-surgical base, volume, and shaping. And so it's done with a small micro cannula. The products, the Restylane brand has local anesthetic in it, so you're freezing as you go. And so it is really a reasonably comfortable experience and with an immediate effect. So literally you could look 5 years younger in 15 minutes.
So the whole thing takes about 15 minutes?
About 15 minutes. About 15 minutes to get the shape and the volume. You may add some other energy-based laser, tightener, color corrections, some little Dysport or Botox, and get yourself a comprehensive treatment, but about 15 minutes.
That's amazing. Where are the commonly used, where do you use it mostly in the face?
The nice thing about our soft tissue filler products now is you have different products for different areas, and so you select almost like you would be painting a picture, different colors to create the canvas. And so under the eye, in the temporal area, the sunken cheeks, around the mouth, and along the jawline. So you don't want to look like the dreaded filler face, which is overdone, but restoring the appropriate amount of volume is probably the most important thing we do with aging. And so those are the most common areas: cheeks, under eye, smile line, around the mouth, prop up the corner of the mouth, and look great, not done. What's
happening to the people that do have filler face? Does it just mean that they're going in every Tuesday? Because you're saying you can do this once a year, so is it that they're doing too much, or are they doing it in the wrong places?
I think it's a combination of both things. I think that you know, the overzealous desire of the injector to create that instant wow, and using too much and overdoing and overstating the volume is the danger. So it's not the product, it's usually the injector. The product is great, done well, once a year for maintenance is all you need.
Okay, that's good to know. So recovery, the procedure takes about 15-20 minutes, you said. How long does recovery take?
I tell patients, you know, you might be lucky and have not much swelling or bruising and you look great the next day, but anticipate 2 days where you're not looking your best. Perhaps blame it on a dentist. That's always a good strategy. And then a little bit of cover up if you have a little bruising, because we inject deep with the microcannula. Bruising's uncommon. So 2 to 3 days, and if you have a big event, plan it about 5 to 7 days before the big event.
Okay. Are there any areas you should just not use it?
All areas are reasonably safe with a good injector. Be careful under the eye for obvious reasons, and don't overdo the lips. They can look a bit exaggerated. But really, any area with multiple family product lines like Restylane, we can attack any deflating area: the tip of the nose, the bridge, the lip, the eyes. So really, select the areas that are appropriate to your face.
Okay, that's very cool. Now, is there anyone that should say, you know what, I'm not actually a candidate for soft tissue filler, I should stay away?
Yeah, people, if they have too much soft tissue laxity, like if you can grab your jowl, you can do the test now, and you pull, and you can't see your ear, it's not a filler. That's a 911 scalpel emergency. But in general...
Okay, I think I'm okay still.
You're good.
Okay.
But if you're pregnant, if you're on anticoagulants like blood thinners, these are, or you have a medical condition uncontrolled, these generally should not be soft tissue filler patients.
There's so many other really quick procedures you can actually get done over lunch hour, which I think is so cool. Tell me about the vampire facial.
Yeah, so you can take your fillers like we did with the Restylane brand. You can add some plasma-rich protein, so we do a little blood draw, and while you're getting your filler, we spin it down, and then we take your stem cells and your little growth factors, and we put them on the skin. We might do a little micro needling so they penetrate great. So the vampire facial, which is quite sexy. We can take energy devices that tighten your skin, light devices that color correct, redness, rosacea, brown discoloration. All that can happen in about 30 minutes, literally 5 years younger in about half an hour.
What does putting the blood from here and there do to your face?
Well, it sounds cool, and And everybody
does.
likes vampires, and they
Yeah.
live forever. And so it's taking, the blood has certain factors in it, platelets, and platelets are important for wound healing, and stem cells. And we spin it down in a way and draw the fragments off so that the stem cells are reinvigorating the tired parts of your skin.
Very interesting. Ladies, you look so amazing. I'm so happy that we could do this for you. After the break, we've got someone else who looks amazing. We're revealing our makeovers.